What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my playlist on EMS, EMT, and Paramedics. In a previous video, we talked about the ABCs, airway, breathing, and circulation. Today, we'll dig deeper into the topic of patient assessment on the scene. And you will learn about the vital signs, and you will learn about the difference between a medical call and a trauma call. Moreover, you will be more knowledgeable on assessing which patient has the highest priority of care because it's a true emergency. Click the like button, click the subscribe button, and let's get started. This is my EMS, EMT, Paramedics playlist. Please watch these videos in order for maximum understanding and retention. So what are we talking about today? Well, once you arrive at the scene, you need to take a look at the scene. Do we have any hazards there? Are there any weapons? Dangerous chemicals? Is the scene icy? Do we have snow? Is the building on fire, etc.? Do not enter a scene that is not safe and secure. If the scene is unsafe, make it safe before you enter. Next, how many patients are we trying to help? Is it one patient, two patients, or multiple patients? Who should I ask? You should ask the patient himself or herself. The patient knows the best. What if the patient is not responsive? Ask the bystanders, the parents, the family members, the neighbors. Then try to establish whether this is a trauma case or a medical case. What's the difference? A trauma patient is a patient who has been traumatized physically, not emotionally. Medical is everything else. For example, a heart attack is medical, not trauma. A stroke is medical, not trauma. Severe headache is medical, not trauma. How about gunshot wounds? That will be sharp trauma. How about my chest hitting the steering wheel in a car accident? Blunt force trauma. So trauma could be by a sharp object or by a blunt object. But of course, this distinction is not that distinctive. For example, I can give you a case that is both medical and trauma. How about if someone stabbed me in the chest with a knife and the knife trauma caused myocardial infarction? Oh, this is both. But of course, we're going to classify it mainly as trauma because the trauma happened first, or because there is trauma on the scene. Okay, whether it's trauma or medical, first things first, ABCs, as we have discussed in video number 1 in this playlist. Airway, breathing, and circulation. Or we can say A, B, C, D, E. Does anyone remember what the D and the E refer to? If you know the answer, comment below. If it's a trauma, we need to know how was the patient injured. You need to ask the patient and or the bystanders. If it's medical, what's the nature of the illness? Is it an allergic reaction? Is it a broken bone? Is it a sprained joint? Is it a severe constipation or what? After taking care of the scene, let's take care of the patient. You need to know the age of the patient, the sex of the patient, the appearance of the patient. Does the patient appear comfortable or in distress? Does the patient appear blue in color, cyanosis? Does the patient appear pale, anemia? Does the patient appear yellow, jaundice? Did the patient's skin turn, for example, from a white color to chocolate-like color, methemoglobinemia? In females of childbearing age, is she pregnant? This is very important. Next, after you learn about all of these facts, whether explicitly or implicitly, you need to introduce yourself to the patient. And then you ask the patient, hey, what's your name? Is the patient conscious and responsive? If the answer is yes, of course, you're gonna look at your ABCs. But if the patient is aware and understanding your questions and responding to your questions, this basically means that the A and the B is fine. Check the pulse to make sure that the C is fine as well. So that was easy. But what if the patient is not conscious, not responsive? Still, you're gonna check the ABCs. You cannot take anything for granted right here because the A could be problematic, the B could have a problem, and the C could be poor. So, what should I do to the airway? First, what's the airway? What's the difference between airway and breathing? Airway is anatomy, breathing is physiology. What do I mean by this? Airway is the pipes. Are the pipes open? Is the nose open? Is the mouth patent? How about the pharynx and the larynx and the trachea and the bronchi and the bronchioles? Everything is open. If everything is open, the airway is fine. However, I could have normal pipes, but I'm not drawing breath in. I'm not drawing air into my chest. So, airway is not the same as breathing. Airway is the anatomy, breathing is the physiology. Breathing cares about how fast and how deep the breathing is. Who controls the breathing? Your brain does. Which part of the brain? Is it the forebrain, midbrain, or hindbrain? It's the hindbrain. Which part of the hindbrain? Is it the cerebellum, the pons, or the medulla? It's the medulla oblongata. So the airway is the pipe. Breathing is inhaling and exhaling, rate and depth, how fast and how deep. C is the circulation. What's the name of the central pump? The heart. How about the periphery? It's made of vessels. Is the heart good enough? And are the vessels good enough? Good enough to do what? To give oxygenated blood to every cell in your body and to receive deoxygenated blood from every cell in your body. i.e., to perfuse your tissue, including your brain and the heart itself. What if the patient's airway is closed? What if there is a swelling in the mouth? The throat is swollen, the tonsils are so big, then you need to open the airway. What if the patient is not breathing in and out? There is apnea. A means no, P-N-E-A means breathing. Apnea means no breathing. If the patient is not breathing, you need to ventilate. Next, for the C, you check the pulse. The pulse tells you about the circulation of the patient. What if the pulse is absent? Start the CPR. Why? What does the CPR have to do with the pulse? I'll tell you. When you perform CPR or cardiopulmonary resuscitation, you're pressing with your hands on the chest. Press, press, press. What you're doing is you're mimicking the action of the pump. Because the pump is not sufficient, you will pump the blood to the patient's body manually by pressing on the heart about 75 times per minute, because this mimics the natural heart rate. So, when there is no perfusion to the patient's periphery, you need to mimic that. You need to cause that pump to work to push the blood to the periphery. The periphery means everything except for the heart. Next, vital signs. What are the 4 vital signs? You should never forget this. Pulse, pressure, respiratory rate, temperature. Pulse, pressure, respiratory rate, temperature. Notice that I said pulse, I did not say heart rate, because pulse and heart rate are not synonymous. More on that soon. Then blood pressure, then respiratory rate. Do not tell the patient that you're measuring the respiratory rate, because if you tell the patient that you're measuring the respiratory rate, the patient will consciously alter the respiratory rate, because when the patient knows that he's being observed, he will change that. So, do not tell the patient. A good way to do it is to measure the respiratory rate while keeping your fingers on the patient's pulse as if you're measuring the pulse. When you have already measured the pulse before, now you're measuring the respiratory rate, but the patient does not know that. Of course, if the patient is unconscious, you do not need to hide anything from the patient. Next, temperature. Quickly, by the back of the hand, measure the patient's temperature over the forehead, for example, and see if the skin is moist or dry, if it's sweating or not, etc. After this, you're going to measure the temperature with your thermometer. Causes of high temperature and low temperature will be discussed later. Next, patient priority. Which patient takes priority? In other words, who are the patients that need to go to the emergency room immediately, right now, without wasting a moment? Here are the examples. Number 1, the patient is unconscious, unresponsive, and there is no gag reflex. That's an emergency. Go to the hospital. Well, the patient is responsive but cannot follow command. We're gonna go to the hospital. A female in childbirth, during labor with complications. We're going to the hospital. Severe pain. That is 10 out of 10. We're going to the hospital. Severe bleeding that's hard to control. We're going to the hospital. Dyspnea, which means SOB, which stands for shortness of breath, because I'm a good guy, I do not curse. A patient who is in shock, which means hypoperfusion or no perfusion, needs to go to the hospital right now. Perfusion is the ability to deliver oxygenated blood to every cell in the body, including the brain and the heart itself. So, if the patient is unresponsive with no gag reflex, responsive that cannot follow commands, during childbirth with complications, severe pain, severe bleeding, dyspnea, and shock, we're going to the emergency department. Depending on the circumstances, you can initiate advanced life support and then go to the emergency department, but you need to use your judgment, because sometimes you'll have to wait for ALS for a long time when the emergency department is next door. So if that's the case, then go to the emergency department and let them handle that. But what if it's not an emergency? What if it's just, well, my little toe hurts? Then we're not going to the hospital right now. We will wait and treat. So basically you have two options. It's either wait and treat or load and go, otherwise known as stay and play or grab and go. Who on earth came with these shortcuts? Next, what if it's wait and treat? Oh, it's just a minor pain in my foot or in my hand. What should I do? You're gonna ask the patient about the symptoms. The symptoms is what the patient describes. The signs is what you, as a provider, can tell. The way I remember this is the following. Symptom has a Y, so you, the patient, are going to tell me. However, the word sign has an I, so I, as a paramedic or a nurse or a doctor, will discover that sign. Example, pain is a symptom. Tenderness is a sign. I feel warm is a symptom. But the core body temperature is 37.8 degrees Celsius is a sign. Next, the A. Do you have any allergies? Allergies could include food allergy, environmental allergy, or allergy to medications. The M. Do you currently take any medications? When was the last time you took the medication? What was the dose and what was the mode of administration? Was it an oral pill? Was it an injection or what? Next, the P, which stands for pertinent history or present history. Do you have any illness? Oh, I have heart failure and I see my cardiologist. This is pertinent history. Next, when was the last oral intake? When did you eat last? And what did you eat? Why does it matter? Because it could be an allergic reaction after the meal. For example, some people are allergic to shellfish. Some people are allergic to peanuts. Last, the E, events that led to this episode. You know what? I was running on a treadmill when I suddenly felt a central chest pain. Well, this could probably be a heart attack. This is angina upon exertion, which is not the same as, well, you know what? I was resting, I was relaxing on the couch when I felt a chest pain. This is different. This is angina during rest. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. Next, levels of consciousness. Well, depending on which book you read, depending on the classification, we can classify this in many ways. Here's one classification that I like. 1 is conscious. That's the best. Then, as you go from 1 to 7, you're deteriorating and deteriorating and deteriorating until you are in coma. After coma, the next step is that you become history. So what's after conscious? Confused. Then delirious. Delirium is a significant, important medical topic and a medical diagnosis. Next, somnolent. The word S-O-M-N means sleep. How about insomnia? In means no, somn means to sleep. So insomnia means I cannot sleep. But somnolent means I'm very sleepy. Then I go to become obtunded. Whenever you find roommates living together and one of them is a paramedic, a nurse, or a doctor, the jokes take a whole other level. Hey Adam, why didn't you take out the trash? Do not talk to me right now. I am obtunded. After this, stuporous, from stupa, and then comatose as in coma. There is another classification. It goes like this, A-V-P-U. A, I'm alert. I can understand you. I can answer your questions. Worse than this is V. Well, I'm not alert, but if you ask me, if you try hard to grab my attention, I can respond to you. Worse than this is that I cannot respond to whatever you're saying. However, if you pinch my finger, I'm gonna say, ouch! So that's respond to painful stimulation. Last is the U, unconscious. You can talk to me, you can yell at me, you can insult me, you can traumatize me, you can torture me. But there is one thing that you can never take away from me, my consciousness, because I do not have any. If you want to see more videos like this in the future, please drop an emergency siren emoji in the comments. Next, let's focus more on the pulse. Where should you check the pulse? Well, we have many arteries, including the carotid arteries. Where do you find the carotid arteries? First, look at the neck of the patient. You need to outline the contour of this famous muscle known as the sternocleidomastoid. It's called sterno because it's attached to the sternum, cleido because it's attached to the clavicle, and mastoid because it's attached to the mastoid process of the skull. This is the sternocleidomastoid on the left. This is the sternocleidomastoid on the right. Where do I find the carotids? On the inside of the sternocleidomastoid. So you'll find the right carotid here and the left carotid there. You need to touch the artery with 3 fingers. Use this technique for any artery you want. However, be careful with the carotids. Never, ever, 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 ever try to examine both carotids at the same time. Otherwise, the patient might collapse from a baroreceptor reflex. So when you check for the carotid pulse, you only check for the right carotid and then you remove your hand. Then if you want to check for the left carotid, you can repeat the same thing here after removing your fingers from here. Now, if you do not train on yourself, you will never be able to locate the pulse on the actual patient. So please pause the video and try to locate your carotid. Examine your right carotid first and then examine your left carotid. Please pause the video and do so. Do not examine both of your carotids together. Next, at the armpit, there is the axillary artery on the right and on the left. Here, as the pelvis ends and the lower extremity begins between the pelvis and the thigh, there is the femoral artery. How do I find the femoral artery? First, you need to locate the inguinal ligament. Where do I find the inguinal ligament or the inguinal ligament? It's between the anterior superior iliac spine and the pubic tubercle. This is the inguinal ligament. And then what? Then you're gonna say the word vein. This is V, followed by A, followed by N. What does that mean? V is a vein, A is an artery, N is a nerve. Vein. Vein, artery, nerve in this order. From the inside to the outside, vein. Do you want the vein to hit your pubis? No! I want the vein to move away from me. So the V is here, the A is here, the N is here. The vein is moving away from me in this order. This is femoral vein, femoral artery, femoral nerve. Femoral vein, femoral artery, femoral nerve. So the femoral artery is about here. Now I want you to pause the video and try to palpate your femoral artery and feel its pulse with 3 fingertips. Now pause. Currently, there are hundreds of people simultaneously grabbing their crotch. Are we in some sort of a cult? Next, let me tell you what happened to that femoral artery. The femoral artery still is femoral artery. Then it's gonna wrap around the thigh to go behind, and it's going to change its name from femoral to popliteal artery. And the popliteal artery will be located here, behind your knee. Now please pause the video and try to locate your popliteal artery. One technique that might help you in the beginning, but please do not do this for the real patient, is to press really hard in the beginning and then gradually weaken your grasp, weaken your pressure until you feel the artery pulsating. So the femoral became the popliteal behind the knee. Yes, and this popliteal will give me anterior tibial and posterior tibial arteries. The posterior tibial is posterior, the anterior tibial is anterior. The anterior tibial will give me something important called the dorsalis pedis artery. I want you to count your toes. Big toe, this is number 1, 2, 3, 4, and 5. Look at number 2 and go up, 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 up until about here. This is where your dorsalis pedis artery is. Now pause the video and try to examine your artery. What is this? This is the dorsalis pedis artery. Where did it come from? From the anterior tibial artery. Where did the anterior tibial artery come from? It came from the popliteal artery, which was behind the knee. Where did the popliteal artery come from? It came from the femoral artery. Remember the vein. So the femoral will become popliteal. The popliteal will give me anterior tibial and posterior tibial. Where's the posterior tibial? This is the posterior tibial, and it will go medially, not laterally, towards the inside, not the outside of your leg. And you can find it behind your medial malleolus. Now pause the video and try to find yours. Why is this dude grabbing a pole like this? What's the point? Axillary artery is here, brachial artery is here, and the brachial artery will divide into radial artery, closer to your thumb, and ulnar artery, closer to your little finger or your pinky. Now please pause the video and try to feel your brachial artery, and then try to feel your radial artery and your ulnar artery. For the sophisticated students, the radial artery is lateral to the tendon of an important muscle known as flexor carpi radialis. Flexor because it causes flexion, carpi because it goes to the carpal bones and metacarpal bones, Radialis because it's near the radius bone and not the ulna. Here is a tip for the pros. If the patient is an infant, we usually palpate the brachial artery because in infants, the carotid artery and the radial artery are difficult to palpate. Next, I've told you that the pulse is not the same as heart rate because pulse is not just the heart rate. It's also the rhythm, the volume, the character, the equality, the arterial wall, the other pulsations, the force, the tension, the thrill, and everything else. Again, transport priority. The patient is either wait and treat or load and go. Stay and play or grab and go. When should you load and go? Unresponsive with no gag reflex, responsive but cannot follow commands, childbirth with complications, severe pain, severe bleeding, dyspnea, and shock. How do I remember this? I memorize the first two together. One is one is responsive. Unresponsive, responsive. And then what? Childbirth is alone, and then severe pain with severe bleeding, and then dyspnea with shock. And this is everything that we talked about today. Please take a moment to pause and review. Let's answer the question of a previous video in this EMT-EMS Paramedics playlist. The high-efficiency particulate air respirator should be worn by an EMT personnel when they are exposed to patients who have what? Is it A, B, C, D, E, or F? Please pause the video and try to answer this yourself. Well, the reason why I'm gonna wear a respirator is to decrease my exposure to a communicable disease that transmits by aerosols, by droplets. Hepatitis A is not transmitted by droplets, neither is hepatitis B. Hepatitis C, c'est impossible. HIV/AIDS, c'est impossible. Tuberculosis, absolutely. Open wounds, extremely unlikely. So the correct answer is TB. And here is today's question. Please choose the highest priority patient. Here is A, B, C, D, or E. Let me know your answer in the comments. You will find the answer key in the next video where we talk about the vital signs. If you want to be an excellent doctor, nurse, or paramedic, there is an emergency medicine high yields course available on my website, medicosisperfectionalis.com. It will teach you about heart attacks, strokes, cardiac arrhythmias, acute respiratory distress syndrome, diabetic ketoacidosis, acute limb ischemia, drowning, and lots of toxicology topics. What's the agent that caused toxicity, and what's the antidote? This course has videos, notes, and cases, and you can download it today at medicosisperfectionalis.com. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, and physics make perfect sense.